I'm Dr. Amy Nasamran, and this is Divergent Minds. Hi there, I'm your host, Dr. Amy Nasamran. To quickly introduce myself, I'm a psychologist based in Michigan, and I work with neurodivergent kids and adults pretty much all over the US. What I love most about being a psychologist is that I get to wear many different hats. I'm also an author, a researcher, and supervisor at Michigan State, an advocate, and now your host. Honestly, my goal is to just spread the love and appreciation for neurodiversity and to help others understand all the amazing different ways that brains work. For this first episode, I'm talking with my friend, Dr. Sharon Adusei. She's also a psychologist and the host of Modern Health's Journey of Parenting podcast. Hey, Sharon, thanks for coming on the show to help me kick things off.
Yeah, thanks for having me.
So I'm so excited to catch up with you and chat more about neurodiversity. Getting right into it, I actually wanted to get your take on something that came up pretty recently for me. So I was recently on vacation with a group of friends this summer. There's also friends of friends who are there. And I get to talking to someone who turns out is also a mental health professional in a different field, though. So they're not psychologists like you and I are. We're talking about our practices, and he asks me if I specialize in anything. So I say yes. I primarily work with neurodivergent kids and adults too. And immediately he stops me and he asks, well, what is that? So I'm caught a little off guard because I just assumed that he would know. But to answer his question quickly, I automatically say, like autism and ADHD. And he says, oh, yeah, okay. So at that point, he's getting it. But I'm curious, how you might answer this question when it comes up.
Yeah, I think it's a great question. And most of the times when I think about the term neurodiversity, what comes up first is, it's a way to describe how our brains learn and think differently, how we process information differently. And a common analogy that I've heard of is to the concept of biodiversity. So this idea that there's so many plants and trees and animals in the world, and having a really rich biodiversity is super important for the health of our planet. And so really similarly, I think neurodiversity is the same. Being able to have a world and teams, that have a wide variety of different ways of thought and learning, et cetera, is just really critical to success.
Yeah, I love that. I love how you explained it. So neurodiversity being more of the umbrella term that talks about, different ways of thinking and learning, and that it's okay for people to think in different ways like that. Yeah, that's such a great way to explain it. I like that a lot more than, I think what caught me off guard was that I started listing the common neurodiverse conditions, and it didn't quite, capture how I personally view neurodiversity. So thanks for sharing your take on that.
One of the benefits of us working with kids is just being able to explain complicated terms like neurodiversity and being neurodivergent. And another analogy that I find really helpful is thinking about how we have different operating systems. So our brain can be compared to an operating system like an iPhone or an Android. And at the end of the day, it's not a problem whether or not we have different operating systems. They might process information differently and then present it differently, but it's rather when our world is designing only for one type. So imagining if there's an application you really want on your phone, but it's only designed for an Android and you happen to have an iPhone. And so I think that can be a helpful comparison because you can also kind of tie it to what are the different types of accommodations or supports that exist in places like schools and classrooms, in work settings, et cetera.
Yeah. And that's such a nice analogy because I think it is such a common experience, right? Like the reality is that our world is not designed to always support neurodiversity. There's the common operating system that it sort of expects people to use or to be, right? And so this idea of neurodiversity being, can we accept that there are different ways of thinking and processing and existing that are neither right nor wrong, but they can sort of exist together.
Yeah,
Yeah.
totally.
Yeah. I love that analogy so much. It sort of helps me think about the next question that I wanted to sort of connect this to is, how do you think kids today and even parents of kids who are learning more about neurodiversity, how do you think their understanding might be shaped by all of the information that's out there on social media right now?
Yeah, absolutely. I mean, I feel like this is a huge influence right now and has been for, the past decade plus of just
Hmm.
seeing a lot of different types of content, mental health content specifically on various platforms, Instagram and TikTok.
Hmm.
And it's becoming more and more popular with clients. And I know that one of the things that you had mentioned that I thought was pretty interesting was that you're starting to have clients actually bring some of this content to you, saying
Yes.
that it's resonating with them. And so I
Hmm.
think it's been great, for reducing stigma. And I think a lot of folks who are engaging with the content feel a sense of validation and
Hmm.
normalization, that it's not just them experiencing these things. So I think there's immense power in that, and being able to access that level of information, especially when right now it's not the easiest to get into a room with a therapist like yourself that has the expertise and specialization
Hmm.
in neurodiversity. So it makes sense that people are going to these forums. And at the same time, we also know that there's also a lot of misinformation on these types of popular content.
Yes, absolutely. Both of those points, right? On one hand, I think the influx that we're seeing of all this information on social media can be a benefit to people who relate to it, right? They have certain experiences that maybe they were ashamed of, they didn't feel like, was a common experience, but they're seeing other people talk about that similar experience, I think can be so normalizing, where it helps people acknowledge and understand that maybe it's not just me. Maybe it's not something that's wrong with me, but this is an experience that might be a natural human experience, right? It's something that is common. It's something that other people do as well, or maybe other experiences that other people have as well. So I think with that increased awareness comes a certain level of acceptance that I'm really glad to see. I like when my clients are bringing in content and saying, "I saw this video and it made me think of something that I do," and it sort of normalizes it for them a little bit. But to your other point, yeah, I think with all of that educational information out there does bring up the question, how much of it is accurate, right? And we're seeing studies, like you and I have seen that study that has come out recently, earlier this year, that talked about how much misinformation there is on TikTok, specifically about ADHD and other neurodiverse conditions, right? So I think the study said something along the lines of over 50% of the videos, the TikTok videos that they reviewed, contain some level of misinformation about it. So what do we do with that?
Yeah, absolutely. Yeah, and when you sent that research study, I found it pretty fascinating, especially because when you take a look at the numbers, when you look at the number of views that each one of
Mhm.
these videos is getting, it's like on average over 5 million, right? So
Yes.
this is like has a very broad reach.
Yes.
And within that over 50% of inaccurate claims, they broke that down even further to say they basically had expert psychologists reviewing the videos, and
Mhm.
they categorized that almost 70% of what was being spoken about on these videos was normal human experience. So
Uh-huh.
like you're kind of referencing.
Yeah.
And then around 40% was actually listing different types of symptoms that can be attributable
Mhm.
to multiple different types of mental health conditions that aren't necessarily neurodivergent
I
conditions.
see. So it might not necessarily be characteristic of ADHD or autism.
Yes. Yeah,
Mhm. Mhm.
exactly. And we know, from our training that there is a lot of overlap of
Yeah.
these types of symptoms. When people
Right.
come in and they're reporting, look, this is what I'm experiencing. I'm
Mhm.
having difficulty focusing and
Mhm.
I can't seem to get task accomplished at work.
Mm-hmm.
When we hear some, like, that's the reality of when somebody is coming into our like virtual doors or in person. This is what they tell us.
Mm-hmm.
But there's also a lot of other conditions that can capture that. Things like anxiety or things like experiencing trauma, right? So there's a lot of other core root symptoms there.
Yeah.
So they also, happen to observe that in the social media content. And I think the other interesting connection that they were drawing was that viewing this content then had an impact on actual emotional experience or their behavior. So for individuals who were coming in and they were self-diagnosed as ADHD, they became even more confident that they had ADHD after watching those videos. And that it seemed like they weren't as open to hearing a psychologist's explanation of video on that content.
Interesting. So what I'm hearing you talk about is the potential, I don't want to say danger, but to be critically thinking about when we're looking at psychoeducational content that we're seeing on social media or on the internet or what have you, to be really careful about taking one characteristic or one trait and then using that to explain a clinical diagnosis or to pathologize it.
That's right. And one of the things that they found was that I think it was less than 5% of like additional context or nuance that was added in some of this video content. So, the best case scenario is like, for the other thing that they pulled out too, I'll say, is that 0% of the individuals had a background as like a psychologist or expert in this area but I also don't want to downplay the importance of lived experience, right? So a majority of these individuals had lived experience with ADHD specifically. And so it's like, how can we, in our ideal world, it's like influencers who have this level of reach, over 5 million views, it's like they have to hit us up to be like, let's make content together, right? To see how can we make this more psychoeducational that still speaks to your experience. But the takeaway that I think you were getting at was really how do we think more critically when we do view this kind of content, but also for individuals where this content is totally landing for you and really resonating, just notice how it's then impacting your behavior or the way that you're feeling in the moment. And you making sure that you get to decide, is this helpful for me or unhelpful for me? And in what ways? Because that's really where it becomes then an empowered decision for the individual to be able to move forward with, okay, I'm taking in this information and then deciding how I want to act on it.
Yeah, absolutely. I hear what you're saying. To your point, I think lived experience is so important. And as psychologists, we're not here to dismiss that. We hear you. We want to learn about what your lived experience has been like and to get potentially a professional opinion about it so that, what you're saying, I think what you're describing is that one symptom or one trait or one behavior, it does not necessarily indicate a clinical diagnosis, right, or a neurodivergent condition. We can't just look at one thing. We're not looking at neurodivergence as a checklist of things to check off. It's not necessarily just, that's me, I do that too, and so I, identify with this neurodiverse condition. Sort of a both lived experience and having somebody who's trained being able to look at the whole picture.
Yeah, absolutely. And I think for both of us, we're certainly not the first to admit that there are issues with our diagnostic manual, right? That like changes over time, it evolves over time, and probably for a good thing that it's evolving over time. But I mean, it does make me think back to, our grad school training days until now, and how we didn't even have the term neurodiversity. Like I didn't come across that term until much late. Like I'm trying to think of when. I think it was actually after getting our doctorates.
School.
Yeah,
you're right. Yeah, absolutely. Same experience for me. Even though this is something that I studied and researched, it wasn't. Neurodiversity was not a common term that was being used during our grad school days. So fun fact for listeners is Sharon and I actually went to graduate school together in different programs, different psychology programs, but we overlapped around the same time. And so that, I think what you bring up leads really well into the next thing I wanted to catch up with you on is how do you think our understanding of neurodiversity has evolved from, 2010 to 2020 into now?
Yeah, well, one of the things that when we were in training that I actually saw pretty consistently across the board, not just for the neurodivergent community, but other marginalized populations, was a really heavy deficit-focused lens.
Mm-hmm.
And that would translate over into the types of interventions we would use too, right? So the way that we would speak about it was really focused on treating the symptoms.
Mm-hmm.
And with the term neurodiversity, the term itself has these grassroots origins from autistic activists,
right?
Really trying to advocate that their community is not one that needs to be fixed or cured, right? Which is ultimately the lens that oftentimes a deficit-focused perspective takes, but rather really seen and embraced for their differences. And then that term ended up now, like when I took a quick look at it just to see the degree to which it's caught on in like researchers and clinicians starting to use this term. And there's over 40% year-over-year increase in the use of the term neurodiversity in scholarly articles, meaning that there's a fundamental shift in language in academia, especially in the last 10 years, which is great to see. And I think it also has impacts on, like I was kind of referencing, the type of intervention that is ultimately used.
Yeah, absolutely. I think that, what you mentioned about treatments and interventions being so deficit focused, right? That's something that I also saw a lot of when we were in graduate school. It's sort of that medical model lens of if somebody is neurodivergent, then they are lacking in certain skills, or there's a deficit in certain skills, right? Like attention skills or social skills. And so a lot of the treatments that we were trained in or that we were learning during our grad school years was about addressing that deficit. How can we teach a neurodivergent individual to have less of a deficit in attention skills, right? Or we're teaching autistic clients social skills to sort of meet what we consider to be typical standards. And I think now in 2025, we're really having to question, was that the appropriate approach versus using a neurodiversity lens or coming from a more neurodiversity affirming angle? It's, yes, teaching skills can be helpful, but is it to meet this quote unquote standard that we have established as the norm or typical?
Yeah, absolutely. And, we haven't even scratched the surface of talking about the different strengths of neurodivergent kids and adults who we've worked with, as there are many. And, I'm thinking of one client that I had in particular who would just come up with the most immersive visual metaphors for various emotion regulation skills that we were working on together. He came up with this entire emotion city, very like Inside Out-esque, where various regions of the city, there was a anxiety burrow, and a burrow that was more of his joy and happiness, and one that was more frustration and irritation. And we could build upon these really rich guided visual meditations to help him turn up or down the volume of these different burrows, right? And so all of that was naturally occurring from this young child. And it's strengths like that I see so much ingenuity and creativity. And oftentimes, like, I'd be curious for your client base as well, what you've seen, because I'm sure you've experienced a lot too. There's a lot, especially for adults, where they've grown up in environments where they've had to develop compensatory strategies to make it, to be successful within certain classrooms or social settings or environments that were not necessarily crafted to support their learning style or their communication style.
Right.
And these compensatory strategies are incredible. And also, there are times that they can take up a lot of brain space. So the amount of willpower or attention resources that are then left over, there's not as much. But sometimes I do think that we see that for those who have later diagnoses in life. It's because they were so smart and creative to be able to come up with these incredible compensatory strategies to survive in whatever environment they were in.
Right. Right. And you're bringing up such an important point here where I think, treatment and therapy in the past has sort of ignored or neglected to address these strengths. Right. And again, to your point of teaching to the deficit or trying to fulfill that deficit, whatever it might have been. I think now we're seeing a lot more interventions and treatment approaches that are acknowledging strengths of neurodiverse individuals and then being able to incorporate those strengths to help them learn the new skills that it is we're working on in therapy. Yeah, absolutely.
Exactly. Yeah. I think a really good example actually is one intervention that we've been trained in quite a bit, the parent management training or behavioral training, which oftentimes it is still like a first line intervention, I believe, for children with ADHD.
Yeah.
And the whole premise is that you need to help the parents set up a proper behavioral motivation plan. So choosing the rewards and motivators that are going to be motivating for the child. And at this point, there's an intervention that both of us actually came across after after our training.
Right.
I think it's been around for quite some time though, where it's called collaborative problem solving. And
big fan.
Yeah, and their whole approach and perspective is that kids do well if they can. So not necessarily kids do well if they have the right reward, but kids will do well if they can, meaning they have the right skills and the right support, which ends up being a really different lens, actually. And so the intervention looks quite different.
Yeah, I'm glad you brought this one up because, the collaborative problem-solving approach, or I think it's collaborative and proactive solutions, the CPS model, isn't one that I necessarily was taught or one that I was trained in during grad school. And I was using more of the, parent management training, this PCIT certification, which is more behaviorally based. Then for me now to be able to come across an approach that I think works really well for the neurodivergent kids that I've supported in terms of being able to understand, well, what is the skill that they don't have in this particular situation? Because again, the underlying message here is that they would do well if they could. So what skill do we need to be teaching? And then approaching it more from a lens of curiosity.
Yeah, absolutely.
Instead of here's the way you have to be, this is the standard that we expect all kids or humans to behave in, right? And then teaching to that.
Yeah, totally. And I think it's less about, I'm curious what you find in your practice as well, but it's not that, one or the other is bad or good, but there are some times that just like how you need different parenting styles for different temperaments of kids, there are different types of interventions that suit individuals better or worse.
Yeah. Not a one size fits all. It can't be that way, right? So being able to take into individual characteristics and needs and strengths. I like how you brought that up. Being able to really understand a person's strengths and then using those strengths to build on the skills that they're learning. Yeah, for sure. Yeah, so we're talking a lot about intervention and treatment. We've talked about different conditions like autism and ADHD. So I'm curious what you think about this. What's your take on labeling a child or a person?
Great question. Yeah, so ultimately, big picture, when I think about this, I think about what is going to be most empowering for the client, whether that's a child, a parent, or an adult coming in, looking for an understanding of what they might be experiencing. And there are times when there's a client who receives a diagnosis and they will they'll break down because they're like, oh my gosh, I have been trying to figure out and understand what's been going on. And this finally captures everything that I've been experiencing. Like this, thank you for this.
Yeah.
And there are also times when there's a lot of resistance to this is not me. And there needs to be an open conversation about that.
Right.
And being able to hand back more control to the client to say, well, what does feel good for you? There are some realities that we deal with when it comes to diagnosis just in the mental health field, which is that, you know, especially for kids, well, actually adults as well, there are times that diagnosis will help you put into place certain accommodations, say at school, in a university setting, right? Like when we were in training, a lot of the comprehensive neuropsychological assessments that we were doing were for university students who were coming in and believed that they had ADHD and wanted to be able to document that and then also receive appropriate accommodations in the classroom, like extended time on tests or a quiet room to be able to take their test. And the reality is that, there are some times that diagnosis is then needed to be able to obtain certain things to create a support system that is going to be beneficial for neurodivergent individuals.
Yeah. Yeah. So what I'm hearing are some benefits, and this is something I've seen with a lot of families and clients too, is that relief, right? Being able to finally understand, I knew there was something going on, and I didn't have the language or I didn't have the words. I didn't have the answer. So a lot of times families can see a diagnosis as something that brings relief. It brings a level of understanding, and it can help, I think, guide direction in terms of what services and supports are going to be important, right? Or helpful. So benefits there in terms of being able to understand a person. The other benefit that I hear you talking about is that it could open doors to access these important accommodations and supports, whether that's in the college setting or for the kids that we work with being able to access certain accommodations at school. But it makes me think about work too. I've got some adults that I'm working with who, with a diagnosis, are able to go to HR and say, here are some accommodations that would make it better for me to be productive at work. Here's what I need to do my best work. So, in short, I think that it helps somebody understand themselves and it helps somebody be able to advocate for their unique needs. On the other hand, I do sometimes work with families who are a little hesitant to getting a diagnosis, not because of the diagnosis itself, but I think common fears or common worries that I hear are ones about, is this going to define my child? Or is this diagnosis going to now define me? So I think that's the other side of the coin here, is this worry of a diagnosis being labeling or definitive or trying to put somebody in a box.
Yeah, absolutely. And the degree to which that diagnosis follows them over time. Yeah. And I think a lot of those fears are totally valid. Like, one thing that probably isn't spoken about enough is within our field of psychology and a lot of the comprehensive assessments that we now use, which we can definitely get into, because I do think that there's a lot of misconceptions about just how neuropsych assessment works and how that's different than the way that typically people receive diagnoses. But our field has a very strong history of misuse and abuse of assessments and diagnoses. So I think that the fear, especially from specific populations where diagnoses were used to justify oppression, or like in the mid-1960s when there was a lot of pathologizing of identities, like in the LGBTQ plus community, a lot of that is still an important groundwork to understand in terms of what can feed into these lingering sort of biases or misunderstandings about assessment and diagnosis today.
Right. So to your point, I think that it's reasonable to be cautious about what a diagnosis might mean, and in what way is that going to maybe label somebody or define them as a person. And then on the other hand, it could be that a diagnosis helps in certain ways as well. So it may be potentially here an individual consideration, something to think about both sides of the coin.
Mm-hmm. Yeah. Yeah. And then I think, since we were chatting about the influence of social media platforms, I do think we've seen quite a bit of rise in self-diagnosis. Is that something that you're seeing in your practice too?
Yeah, sometimes. Less so of somebody coming in and saying, here's my diagnosis, right? But more questions around it. So sometimes I'll see a client who says, I saw X, Y, and Z on social media. It's something that I really connect with, or something that really resonates with me. And they're sort of curious from my perspective if they would meet that clinical criteria.
Yeah, there's certain points for yourself where in practice, you would then be referring individuals to, maybe you should get a more comprehensive assessment. So like the neuropsych assessments that you do.
Say that one more time.
Oh, I was saying, are there decision points for yourself as like for some clients where you would recommend that they end up getting a comprehensive neuropsych assessment versus not?
Yeah, I think sometimes if it's more complicated, right? Like something that you mentioned earlier was we can't just look at one trait and say, yes, this is ADHD, or yes, this is autism, right? Like an example might be somebody who's struggling with attention or focus at work or at school. And we don't definitively say, okay, yeah, I think that's a sign of ADHD. It could be, right? Yeah. But there are times I'm working with, or I have worked with people who have difficulty focusing because they're so anxious that it's disrupting their focus, right? Yeah. So if we think that it might be something going on, we don't definitively want to say that like X equals Y, then I think that's when a neuropsych or something more comprehensive can take a look at all of the pieces and formulate an understanding of a better picture.
Right. Yeah, and most of the times, the way that I've heard it in terms of individuals receiving diagnoses, for kids anyhow, is most of the times it's happening in the pediatrician office, which when you go into the pediatrician office, they'll usually have the parent and the child, if they're old enough, complete like a self-report. It's basically questions to be like, rate this, on a scale of 1 to 5 in terms of how much you strongly agree or disagree with this statement. And it might include, I have trouble focusing, paying attention, completing tasks, listening to instructions, etc. And again, a lot of those signs sometimes do overlap with other conditions.
Right.
But at the same time, I can also appreciate the fact that our comprehensive assessments that we keep referring to are sometimes in total 9 to 12 hours across 3 to 4 sessions.
Right.
And then on top of that, like you're talking about a really long waiting list. On top of that, a very significant financial investment.
Of course, yes.
And there are times, though, which I know you can speak from your perspective as a school psychologist, that in the school setting, these are actually assessments that can be completed.
Okay, lots of things I want to unpack here. And this is good. I'm glad you're bringing this up. It's something I'm going to touch on a little bit more in depth in a future episode that we're going to do as part of this series. But normally, what I'm explaining to parents is there is a distinction here between what you're getting at a doctor's office versus what a comprehensive evaluation that you're going to get from a psychologist. In a pediatrician's office or at your primary care, let's say, if you're an adult, what they administer is typically a screener. So, similarly to how you described it, it's a checklist of sorts. Like, is this something you experience? Like, is this like on a scale from 1 to 5? How often? Right? So it's more, I treat that as a starting point. It's a screener of symptoms. And then to your point as well, they're not really screening for other things like anxiety or a learning difference, right? Or something else that could be explaining that particular symptom or trait. On the other hand, yes, a comprehensive evaluation is going to be, I think, sometimes more inaccessible to families too, right? Because it is more expensive. It is more of a time commitment. And then I'm not sure about across the country, but at least here in Michigan, the waiting lists for some of these assessments can be a year or more, right? And so there's a long wait time to get these done. But what's beneficial about a comprehensive evaluation is that you're really taking a look at not just a screener, not just a checklist of symptoms. You are getting information from different informants. You're hearing from the teacher, a parent, the child themselves. Then you might be doing a direct observation or standardized assessments to look at different skill areas. So things like working memory, how they reason, executive functioning skills, right? So you're sort of looking at everything across the board to understand just a more comprehensive, bigger picture of the child, not just a checklist of symptoms. And then the third thing you brought up was the school piece, which is a completely, entirely different assessment process altogether. So I just want to clarify that schools cannot diagnose. When schools conduct an evaluation, it is to determine whether a child is eligible to receive special services, special education services within the school setting. And then they might group the child under a specific category. But schools can't actually give a medical diagnosis, even though they might be administering some of these screeners and some of these standardized assessments. So it's a completely different purpose to be able to do an evaluation in a school is for a completely different purpose.
Yeah, I think that those are all really important distinctions that for sure our field has not done a great job of differentiating.
Yeah, and it can be confusing, right? So I think when sometimes people are referred to get testing, it's such a broad term, and it's like, well, where do I start? Where do I go? What do I do? And there's testing for different reasons, and now it's also the understanding that there's different levels and different commitments to what an evaluation might require.
Yeah, absolutely.
Yeah. But I'm thinking about, I just said the phrase executive functioning, and it made me think about your research. And we've also been talking a lot about grad school. So I remember about your research, and your clinical focus in graduate school was on executive functioning, right? So are you comfortable, or are you willing to share a little bit more about that?
Yeah, absolutely. Yeah, so I was really focused on understanding how skills like executive functioning, which we can get into, and emotion regulation, how those unfold over time. So anywhere from, let's say, infancy all the way up to adulthood. And what are some of the things that would get in the way of these skills? So that could be things like adverse events, like anxiety, like trauma, and what are things that really helped these skills get back on track? Something that people might refer to as resilience. And I studied this through a child temperament lens, which is sort of like kid personality. It's one of the earliest emerging biological individual differences in reactivity and regulation, which we can also define too. But it's important in terms of how it relates to the neurodiverse community, because I do see building blocks of child temperament that make up a lot of different aspects of neurodiversity.
Yeah, and neurodiverse thinking. And that's exactly why I brought this up, is because I think these factors that you studied, right, regulation, executive functioning, are things that aren't necessarily defining characteristics of any neurodiverse condition that we've talked about, but it is an experience, or it's a factor that many neurodivergent people could relate to. And so I'm hoping you can share a little bit more about those things.
Yeah, so we understand temperament as consisting of two components. So the first component is something that I referred to as reactivity. And that really describes our sensitivity to the environment. How do we respond when there's a super loud noise, or there's a sketchy car across the street? Is our reactivity and our sensors, are they on high alert, or are they a little bit lower on the alert volume? And so there's a really popular developmental analogy that I think is so helpful to understand this concept, and it's called the Orchids and Dandelions. So for those who are familiar, orchids are historically known for being sort of difficult to care for. They're very, very specific environmental conditions for an orchid to thrive. And so we'd understand an orchid to represent higher sensitivity to the environment. So usually, I mean, I don't have a green thumb, but like for orchids in particular, it's like you need the right temperature, you need the right lighting, the right watering, and any kind of amount over a certain threshold, it's like, it's gone. There's no getting it back.
They're more affected by the environment.
That's right.
Yes. Okay.
And then you have dandelions on the other hand, which we would consider lower sensitivity to the environment, meaning they thrive anywhere. They're popping up through the cracks of your sidewalk and every which way. And they do fine. And what's really fascinating, though, from a developmental perspective is that our orchids are also the ones that are the most responsive to positive interventions. So therapy and early child interventions and any other type of kind of positive input that you can have. It's not like there's a differentiation between positive and negative impacts from the environment. Whereas dandelions, they respond less so.
Interesting. Why do you think that is?
In part because they have lower sensitivity, so they have lower response to the environment, so they're not going to be as influenced by those inputs.
Yeah, I like this because what the message that I'm getting from this is that sensitivity to the environment or high alertness in general to environmental stimuli is not a bad thing, right? It can, I think in certain aspects, it can bring a little bit more stress to certain situations. But at the same time, it sounds like higher sensitivity also means higher responsiveness.
Yes, exactly.
Maybe faster learning.
Yeah. And the more that I think people can come to understand that concept that, look, this isn't a good or bad thing. It's about how do I work with this? Knowing that this is an aspect of what I experience, how do I work with this to my advantage?
Right.
Yeah.
Right, which is sort of the premise of what we're talking about here when it comes to neurodiversity, right? It's not a right or a wrong or a good and a bad, but if I can understand how my brain works, then I'm going to be able to help myself or adjust or accommodate where needed.
Yes.
More effectively.
And I have a lot of very close, like, best friends and loved ones who are neurodivergent, and it's like one of them had referred it to neurodivergent powers. So it's like, as soon as you figure out the key to kind of unlock the supports that are really helpful for you, once you unlock it to then be able to use your neurodivergent powers at full force, it's like no stopping you, right?
Yeah.
And
I love that.
Yeah. And one other aspect, so the second component to temperament is regulation.
Okay.
And that really refers to our skill to bounce back. So after you have whatever exposure to the environment, an adverse event, let's say, or even, let's not even take it there. Let's just say there's somebody who makes a comment at work that you interpret as negative, right? How do you bounce back from that? That is our regulation capacity. And so temperament is all about what's your sensitivity to the environment and how do you bounce back from changes in the environment. And some of this is determined, right when we come into the world. And a lot of it is also shaped by our environment and our experiences.
Right. So it's not one factor. I think when you say how we come into the world, that sort of, to me, speaks to our brain differences that we're born with.
Yes. Yeah, exactly.
Yeah. And then can you speak a little bit more about executive functioning?
Yeah, let's get into that. So executive functioning, it's an umbrella term for your brain's CEO. Basically, all of your mental abilities that help you think before acting, resisting temptations, being able to stay focused when there's a lot of distractions. And so even just listing these things, you can hear them and be like, oh, these are like really important, right? These are really important skills. And that's 100% the case. And there are 3 core executive functioning skills that we can kind of touch upon.
Okay.
So one is called inhibitory control. This one, people may also refer to this as willpower or self-control, sometimes effortful control. Most famously, some of these skills were measured with the marshmallow task. So asking children to basically wait to eat the marshmallow that was sitting in front of them while the adult left the room. Yeah. And if they successfully waited and delayed their gratification, then they would receive a second marshmallow. So that's that skill. And the way that can come up is like, resisting the urge to eat when you're hungry, if that happens to be a goal of yours, right? There's like a goal-oriented piece to this skill. Yeah. And then another core executive function skill is working memory. And this one is being able to hold multiple things in your mind at once. So I think sometimes understanding these skills, it's easiest to actually talk about some of the assessment tasks that we do in those long neuropsych batteries. One of which is listing a string of numbers and asking you to repeat them back as soon as you hear them, and they get longer and longer, and then asking you to actually do something with it. So I'm going to ask you to actually report them back to me, but do it in reverse order. So this is a core skill for being able to hold multiple instructions or tasks in your mind at once and maybe figuring out what order to do them in. It's one of the reasons why for neurodivergent kids, and then eventually who go on to be adults, sometimes it can be difficult to hear multiple instructions at once. And being able to hold and remember all of those and execute them as well. And then the third core executive function skill is something called cognitive flexibility. And so this is really how adaptable are you when something doesn't go quite your way. It can also look like if I am attending to a specific task, if it's hitting the top of the hour and I now need to switch to something else, how capable am I at being able to shift flexibly to a different task, right? So, I think of some of folks who might have ADHD where hyperfocus is like one of the things that they experience. And so there's a difficulty being able to shift off of an idea or a project that they're on and moving on to something else. And so sometimes this also comes out if, you're able to see that your plan A or your original plan isn't working and being flexible and moving on to plan B and moving on with not too much emotional distress.
Yes. Okay. So to summarize, I'm hearing executive functioning skills, things like impulse control, being able to hold information in your memory. And then the last one, being able to regulate and shift your attention to where it needs to go.
Yeah, that's a great summary.
Yeah. Why do you think that neurodivergent brains can struggle with some of these tasks or skills?
Well, one of the things that we've seen in research is that there has been links made to early child temperament factors and skills like executive function to different neurodivergent conditions. Yeah. So the combination that usually comes up is a combination of that high reactivity piece we were speaking to and something that's called negative emotionality. So how easily you feel worried or upset or other unpleasant emotions combined with lower executive functioning or challenges with executive functioning skills. Yeah. So that ability to manage your attention, your emotions and behaviors, even when you don't really feel like it.
Yeah,
and
right.
What's interesting is that we actually see that combination for anxiety as well in kids and adults.
Okay, yeah, that is interesting, right? So it's not, at the risk of overly simplifying it, what I'm hearing is it's a difference in how the brain is processing information, right? It's a difference in how that part of the brain is working and working to understand what might be happening, right? And then the emotion control part of the brain might also be working differently.
Yeah. And so it could look like I'm somebody who feels everything really intensely. And on top of that, I struggle to manage those big feelings or redirect my attention when I need to. And you can imagine that this can have some impacts, across multiple areas of life, in work and relationships. I imagine that it's something that you hear a lot in your practice too.
Right. It goes back to seeing the world differently, experiencing it differently, and then making sense of it in a different way as well. That might look different from how a neurotypical brain might be interpreting it or experiencing it.
Yeah. And I mean, I think the other key piece to all of this is that oftentimes a lot of, we've been talking about a lot of the skills, so like executive function skills and emotion regulation skills. These are all things that are malleable over time. So there are also things that you can do to improve upon those skills. And in my area, like the clinical focus area that I had was more on anxiety. And one of the things that we saw was the impacts that anxiety can have on things like executive function skills. And one of the things that we know, of course, is that it's also anxiety is something that co-occurs a lot with neurodivergent conditions.
Right. Yeah.
And it makes sense because the way that research has shown how a skill like working memory that we were talking about before is very much impacted by one's experience of anxiety, almost to the point where it's like anxiety is taking up brain space. So all of that brain power that is directed towards ruminating and worrying about the threats and worrying about what's about to come in the future or what you did in the past is taking away from one's ability to be able to redirect those attentional resources to, I have this task that I have to complete or this work presentation that I need to nail. There's less brain power to be able to direct towards those things that are needed to execute successfully on a task.
Right. It's such a common experience that you're describing. I think something that a lot of neurodivergent folks that I know can relate with. Yeah,
definitely.
So we covered a lot today. Thanks for catching up with me and sharing your thoughts about neurodiversity. Some takeaways that I have from our conversation are that neurodiversity is about embracing all differences in how brains work and think. It sounds like, the neurodiversity movement has had a lot of influence in the way that we're looking at different mental health conditions as psychologists, different ways that we evaluate for it, and then different treatment approaches as well. I want to acknowledge that our field still has a ways to go and some catching up to do, but overall, it sounds like we're trending in the right direction in terms of accepting differences and being able to celebrate all brain varieties. Is there anything else that you want to add?
I think that's a great summary. And the only other piece that I would add is that we touched on this too, that neurodiverse individuals are highly capable, extremely creative, like these individuals I think of like in my life who, at this point too, when you look at the numbers, I think it's like 1 in 5 are diagnosed with a neurodivergent condition. And so it's highly likely, right, that we're all in our lives, we have individuals like this or identify as neurodivergent ourselves. I think at times some of the challenges that we did speak about can leave neurodivergent individuals feeling like a failure or feeling like other people might interpret. I actually see this a lot with parents and kids where parents might interpret behaviors as it's out of laziness or being unmotivated or defiant.
Right. Or they're not trying hard enough.
Yeah, exactly. And so the more that we can shift that conversation and that language to it's more that we're figuring out how to manage like a oversensitive smoke detector or alarm system and a more challenged self-regulation system and finding ways to work with the operating systems that we have. And really looking for how can we support different environments and settings so that those strengths can really flourish. And knowing that it's not only going to allow the neurodivergent community to flourish, it will also lift up the entire community, right? I've also seen a lot of different interventions where it benefits additional populations as well.
Oh, of course, of course. I think we're going to see the benefits be, a tenfold if we're able to accomplish this.
Yeah.
Well, thank you so much, Sharon. It was great catching up with you.
Same.
Thanks for spending time with me today. Once again, I'm Dr. Amy Nasamran. Let's keep the conversation going in the next episode. See you there. This audio series is brought to you by Modern Health. The topics presented in this series are intended for informational purposes only and should not be considered a replacement for medical or mental health advice, diagnosis, or treatment.